Good afternoon. My name is Kim Bittner, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted on the NCC COVID webpage, usually within 3 business days. Many times we'll have the recording up on the webpage well before 3 business days. Now let's go ahead and take a look at the agenda for today's call. Today we are pleased to have Drs. Jeffrey Silvers and Lance Salazar from Sutter Health. Dr. Silvers is Medical Director of Infection Control and Pharmacy for Sutter Health, and Dr. Silvers serves as Physician Lead and Expert on COVID-19 for the healthcare system and is a member of the California Department of Public Health COVID-19 Drafting Guidelines Work Group. Dr. Salazar is the Clinical Pharmacy Coordinator for Sutter Health Foundation. Now we will introduce them in greater detail shortly. Our topic today is, should patients with chronic renal disease get the vaccine against COVID-19? Before we get started with our presentation, we wanted to share a new resource with you. If I could have the next slide. A few journal resources have been added to the NCC website. Journaling is writing down your thoughts and feelings, and many people find that doing this helps with their well-being. There is the option to download pre-created journal templates or to use prompts to create your own journal. And the journals are available for patients and caregivers. And we encourage you to encourage your loved ones to try this as well. So please visit www.esrdncc.org/patients and then select the mental health and well-being category in order to access this information. Next slide. So what is this call about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and to share with others. And then this series of calls is available to you bi-monthly, offering a variety of topics. Next slide. Let's go ahead and begin our presentation. I'd like to introduce you to Dr. Jeffrey Silvers, who we already let you know that is the Medical Director of Infection Control and Pharmacy for Sutter Health, where he serves as Physician Lead and Expert on COVID-19 for the healthcare system. Dr. Silvers is a member of CDPH, COVID-19 Drafting Guidelines Work Group. In this role, he works closely with the California Department of Public Health, where he serves on several advisory committees. After completing his medical training in UCLA healthcare system, he and his wife moved to Northern California, where he spent 35 years caring for patients with complex infectious diseases. He is on the board of directors for the Infectious Disease Association of California, the Advisory Council for the California Immunization Coalition, and has spoken nationally on immunizations. Next slide. Lance Salazar has been a pharmacist with the state of California for nearly 23 years, serving in the hospital infectious disease and critical care settings. Following his pharmaceutical practice residency with Mercy Hospital in Sacramento, he has spent most of his professional years in the managed care setting, with a focus in vaccine and biologics provider account management. Today, he's the Clinical Pharmacy Coordinator for the Sutter Medical Foundation, with a large part of his efforts centered on vaccine delivery and clinical readiness for Sutter Health systems. As the chair of Sutter Health's Vaccine Advisory Committee, he is passionate about ensuring that clinicians have the information they need to ensure the successful implementation of vaccine clinics across the system, especially in the preparedness of vaccines to fight COVID-19 disease. I'd like to welcome you both to today's call, and at this time, I'd like to turn the call over to you.
Thank you very much. So today, as you hear, we're going to talk about COVID-19 and its relationship to renal disease and, of course, the COVID-19 vaccine. Next slide, please. So it's important we understand some pretty simple terminology here. So SARS-CoV-2 is a virus that causes COVID-19. COVID-19 is actually the disease caused by the SARS-CoV-2 virus. We have the next slide, please. So I put this together yesterday, and of course the numbers are higher today, and yesterday morning, and you can see at that time we had over 95 million cases that have been identified in the world, with over 2 million people unfortunately dying from this disease. And in the United States, we have now over 24 million cases, and as of yesterday morning, we're just approaching 400,000 deaths. Next slide, please. So the CDC, the Center for Disease Control, puts a list out of people who are actually at increased risk of severe illness from COVID-19. There's also a list of people who might be, and the list changes as they get more information that proves that a particular group is at higher risk. They may change and take some people off if the data says that they actually are not at higher risk, but this list is very good. It's up to date. And you notice, although it's alphabetical, but number 2 on this list is chronic kidney disease. I show that in red there. And then I put diabetes type 2 at the bottom. I put that in red because that is such a common coexistent disease with somebody who has end-stage renal disease. And then, of course, weakened immune system from solid organ transplant, because obviously a large number of people with end-stage renal disease undergo renal transplantation. We have the next slide, please. So I put this together. We're all trying to get to normalcy, and we have a lot of faith in the vaccine. The vaccine is very important, but there's another piece of this that we have to recognize as we look towards a normal life. And that's going to also be that we're going to need an outpatient treatment that's easy to tolerate, effective, and inexpensive, so that we can keep people from getting severe disease and ending up in the hospital. It requires both of them. But what we have today, and what is so important, is a vaccine. And so we're going to focus on the vaccine, understanding that in the future, in order to really get back to where we were, we will have to have an outpatient treatment, but we have to take what we have, and so much will be accomplished by effectively vaccinating people. The next slide, please. So the question is, what are some of the barriers to people getting vaccinated? And I put these together. There's a lot of different barriers, and they interact with each other, and when the end result, those people may not get vaccinated. And if we want to get back towards normalcy, we need people to get vaccinated. So people, of course, have questions about government ensuring safety. It is a new vaccine. There's a fear of getting COVID from the vaccine, which will show you why that doesn't occur. There's an overall mistrust of vaccine, and that some of that is cultural. That needs to be addressed. And of course, there's a lot of political components to our fight against COVID, and then of course, fear of side effects of the vaccine. Next slide, please. So although there are 2 vaccines that have been approved, the Pfizer BioNTech is one, and Moderna, we are going to give you information on both, but they are really very, very similar. You can have the next slide. So this was at Sutter Health when the vaccine first arrived. Honestly, the excitement around having a vaccine has been incredible. Just the people who got to even unpack the first doses were like so excited. And when I go to the vaccine clinics and talk to people who are receiving the vaccine, I've been doing infectious disease for many, many years, and I've never seen a time in my life where people were so excited to go get a jab somewhere, to get a vaccine. People are smiling, and if people want to have their picture taken. It's such an exciting time. Next slide. So let's talk about the mechanism of action with the vaccine and how we get there. So the next slide after that gives you some clues. Okay, so there's a cartoon that I've put together. It's actually from the CDC in the right upper corner here, which shows a picture drawing of the coronavirus. And you'll see these red spikes from this globe, which is the coronavirus itself, and those are the famous spike proteins. Those are the part of the virus that attaches to the cell that then allows the virus to enter inside your cell and cause disease. The red Ys that you see there are a drawing that would represent antibodies. And so here's how we get a vaccine. We know that that spike protein is the important part that the virus needs to attach to you. So that is the protein, the pathogen that we have to counter it. And then we can code the sequence of the gene making that protein. It's amazing the technology that we have today, that you can code the genes of the whole virus so easily with our technology. You separate out the sequence of the gene that makes that S spike protein, and then you create a vaccine using that code. There's multiple different ways you can do it. You can give the gene sequence, which in this case is RNA. It's called messenger RNA, or future date, you'll be able to just give the S spike protein itself, or you could put a different virus in that doesn't infect humans and make sure it can't replicate, and then but you can have it where it makes a spike protein. Any of those ways are possibilities to make a vaccine. So let's go to the next slide and talk about some important points about this vaccine. It's not a live vaccine. It does not contain a whole virus. It does not enter the nucleus of the cell. That's really important because the nucleus is the heart of the cell, basically, or maybe you should say the brain of the cell. And if that virus can't get in there, then it can't become part of those cells and possibly be passed on through cell replication. Instead, it depends on staying in what they call the cytoplasm, the liquid outside of the nucleus, and there it can divide and reproduce itself, but it can't get into your genetics. The virus is quickly broken down by normal cellular processes, and the spike protein that they give you is very quickly broken down, and there's no fetal cells used during development or production. Again, not a living vaccine, does not contain a whole virus, can't make a whole virus, can't get into the nucleus, and the body's able to break it down. Next slide, please. So the studies for the Moderna and the Pfizer had a lot of similarities, so I kind of just clumped them together here. And male and female were approximately equal. They were mostly white, but included in there, about almost a quarter of them were of the white category were Hispanic, Latinx. There were about 10% between each of the studies where they're African American, and higher range of younger than older, and they defined older a little differently between the two studies. And then they also looked at the weight. And so the Pfizer study said that if your body mass index was over 30 kilograms per meter squared, that's obese, and Moderna uses a criteria of 40. And they had a lot of other diseases alongside with them. And so almost 10% had other diseases. Well, 20% had other comorbidities. Out of those, the most common were diabetes or lung disease. And notably, they excluded pregnant women. They excluded lactating women. They excluded people who were really severely immunocompromised because they really wanted to know whether this works. So let's look at some results and how we got approval of this. Next slide, please. So the Pfizer study, Moderna study are very similar, but I just want to show one for time, but they're very similar. They needed about 150 people who would get disease after being vaccinated, and they would see what number of those actually got placebo, which is just salt water, or who got the real vaccine. The Pfizer study had about 20,000 people who got the vaccine, about 20,000 who got placebo. Again, that was just salt water. Okay, they looked starting 1 week after the second dose, how many people got disease. The doses were spaced 3 weeks apart for the Pfizer, happened to be 4 for the Moderna, but not fairly relevant. And they said, okay, 170 people developed COVID at least 1 week after the second dose. Notably, out of that 170, 162 got placebo. They weren't protected at all. Out of the 170, only 8 of them had had the vaccine. And of the 8, There was one case of severe disease. None of them were hospitalized, though, out of the 8. In the placebo, 9 people had severe disease. So not only dramatically reduced the risk of infection, but actually reduced the risk of severe disease, which could lead to death. So then they also said, well, how effective is one dose of the vaccine? So it takes about 7 days as a minimum after you get a dose of vaccine to start to form any antibodies. And the spacing between the 2 doses was 3 weeks. So the first week, they didn't count anything because you really didn't have any response to the vaccine. But the second and third week, though, before the second dose, you might have developed some response to the vaccine. So they would say, okay, so in those second and third weeks, how many people got COVID who got either vaccine or placebo? And notably, 82 people who had placebo got COVID in those 2 weeks, but only 39 of the vaccine. That means it's about 50% protected after one dose. You do need to note, this is important, that with the Pfizer vaccine of the placebo, 9 had severe disease, and with the 39 with the real vaccine, 10 had severe disease. So it didn't protect you from getting severe disease, but it did protect you from getting infection. Notably, after 2 doses, it not only protects against infection, but it protects against severe disease. And efficacy was consistent, regardless of your age, gender, race, or ethnicity. In terms of side effects of the vaccine, which is something we're seeing with both of these vaccines as well as the newer upcoming vaccines for COVID, older adults tend to have fewer and milder side effects, what they call reactogenicity from these vaccines. So let's talk about some of the side effects. Next slide, please. Far and away, the most common side effect is pain at the injection site. That's like extremely common and no surprise. And it's overall pretty mild after the first dose. Around 5%, 1 in 20 has some swelling or redness. I've seen people have swelling for even a week, but most people only last 1 day. It's an outlier where it lasts more than a couple of days. Systemic effects, though, are definitely more common after the second dose. When people as a group have been sailing through the first dose with some very minor complaints. I didn't even actually have any problems at all with my first dose. But when you talk to people after the second dose, the majority have some who got the real vaccine actually do have some things that they notice, with, of course, sore arm being the most common and a few other things which I'll show you about. The main thing is usually it's around day 2 or 3, so not the day of the vaccine, but the day after that people notice other things other than the sore arm, which actually can happen the first day. And typically only lasts about 1 day. Sometimes that's the median, so that's half the time, of people. And then half the people lasted less than 1 day, half it lasted more than 1 day, but usually only a couple of days in general. Next slide, please. Okay, so this is interesting here about the side effects, and this is from the Pfizer site, the Pfizer data that was submitted to the FDA. And if you look at fatigue, headache, muscle pain, and joint pain as categories, the top row of these rectangles will be the first dose, and the bottom row will be the second dose of vaccine. So when you look at vaccine, on the top left is fatigue, and you notice 47% complained of fatigue after the first dose who got the vaccine, most of which was mild. But by the way, 33%, 1 out of 3 people complained of fatigue after the first dose, and they just got saline. There's not a huge difference in the first dose between the placebo and the real vaccine, and the same thing's true for headache. 42 versus 34%, only 8% difference, really not much. And muscle pain and joint pain, pretty much the same. But when you get to the second dose, they really separate. So the bottom left rectangle is fatigue again, and that the 59% is the real vaccine, and the 23% was placebo. So it's more than twice as common to have fatigue after the real vaccine on the second dose, and it is common. And same thing with headache and muscle pain, joint pain. They do separate out, with fatigue and headache being the most common, muscle pain third, and then joint pain is there, but it's much less common. Next slide, please. So 2 doses are important. I said this earlier, and I told you that, 1 dose, about 50% efficacy, so that's good. I don't know how long it's going to last, of course, but it may not protect you against severe disease after 1 dose. Next slide, please. So contraindications, so these are CDC contraindications. So that means you cannot receive the vaccine, and you should not be given the vaccine. So number 1 is if you have a severe allergic reaction, which they call anaphylaxis, after a previous dose of one of these mRNA vaccines or any of its components. And of course, if you're getting your first dose of the vaccine, you haven't ever had an mRNA vaccine before, and if you had it after your first dose, you would not get a second. What we're worried about for components really is something called polyethylene glycol or polysorbate. These are actually very common ingredients that are found in skin products and drinks that you may, non-alcoholic drinks that you may consume. They're widely used. They're in a lot of medications for stabilizing the medication in the product. The reactions are unusual, but not as rare as they are for the flu shot. So a flu shot, the chance of an anaphylaxis reaction is only about 1 in a million. With this vaccine, it appears to be about 1 in 100,000. So places that give the vaccine have to be prepared to counteract any of that. So you have to be watched after you receive a dose. But overall, even those people that have that reaction, although they may not be able to get a second dose, can be either easily treated or respond to treatment. Very, very small numbers ever end up in the hospital. Next slide, please. Okay, so when people get a problem right after a dose of the vaccine, it may not be the vaccine causing allergic reaction. There's a lot of anxiety about getting the vaccine, and sometimes the response is to stimulate what they call the vagus nerve, that can actually dramatically slow down your heart, and you can get dizzy, and you can have you can actually pass out. So when people do have these events occur, then obviously they'll be seen, likely in an ED or somewhere like that, and then the doctors there will differentiate, because not all reactions are reactions to something other than anxiety. The other thing is severe allergic reactions are defined as less than 4 hours from the receipt of the vaccine. Next slide, please. Okay, so we're going to do some frequently asked questions next, and then we'll have a chance for questions from the panel, from the attendees. So next question, and Lance and I are going to alternate. So are the Moderna and Pfizer vaccines equivalent?
Well, thank you, Dr. Silvers. Well, yes, we get this question quite a bit, and, the answer is yes. Both the Moderna vaccine and the Pfizer vaccine amazingly have this very similar 95% efficacy after 2 doses. As Dr. Silvers mentioned earlier in the presentation, those that developed COVID-19 within 7 days or 7 days or after receiving the second dose of the Pfizer vaccine, there were 8 in the vaccine group and 162 in the placebo group. So Moderna was quite similar, where they saw 11 individuals that developed disease in the vaccine group and 185 in the placebo group. So they're very similarly effective. And this is really, when you think about vaccines, this is very, very outstanding when we consider that the flu vaccine every year is roughly only 40 to 60% effective. So these new mRNA COVID-19 vaccines have shown some pretty impressive efficacy. So next slide. So in the news, we've probably been reading about, this variant strain. And with this variant strain, we've been hearing about, will the vaccine still work?
Yeah, so the SARS-CoV, and it should say 2, not 19. Sorry for my typo there. It mutates regularly. RNA viruses undergo a lot of mutations, and the thing about RNA viruses that's different from DNA viruses is they don't actually self-correct the mutations. But so they tend to make a lot of mutations. Their goal is to try sometimes make a more fit virus, and then sometimes it's a less fit virus. But when there's so much disease everywhere, the chances of a fit virus having a mutation that will allow it to survive is high. So the mutant strain initially identified in the United Kingdom is about 30 to 50% more contagious than the strain we have now. Now, more contagious doesn't mean that if you get the disease, you will be sicker as a person. It means that you're more likely to be exposed to somebody and then get the disease. And it's found in, actually, I think it's over 50 countries now. More importantly, they've actually done some studies, and they've shown that it actually, this virus strain is still killed by people who have received the vaccine. So it should work. It should work very well. There will be other mutants. You'll be hearing about them on a regular basis, but the one that's made the most news right now is this particular one, and it works. Next slide, please. So outside of work, if everyone has received 2 doses of vaccine, do we still need to socially distance and mask?
Well, this is something everybody's, kind of excited about, getting back to normal. So everyone's really curious if we all get everyone gets the 2 vaccines, do we still need to do all this social distancing and masking? And, right at this time, widespread vaccination against COVID-19 may not be achieved until mid-2021. So we're still, seeing incidence of disease. We have to, as we talk about flatten the curve, we have to see decreased incidence of disease. And so social distancing and masking practices are still necessary until it is determined we can safely reduce our current guidelines. So to lessen the time that the social distancing and masking will be necessary, we need to get fully vaccinated as soon as possible. And so that, when we can see this, then we can get back to the normal of being around, everybody. But for now, we need to practice all of the social distancing and masking by get vaccinated as soon as possible. Next slide, please. So what if I developed COVID-19 after my first dose? Why didn't the vaccine work?
So as I showed earlier, the COVID-19 vaccine doesn't provide any protection for the first week after the first dose, which is true for all vaccines. And the vaccine may be only 50% protective in the second and third week before the second dose. So, and then Moderna's 4 weeks apart rather than the Pfizer 3 weeks. So again, the vaccine provides some protection. It's incomplete. It may not prevent severe disease. That's still up in the air. So you really do need to get a second dose, and that's why some people do get disease after they've received the first dose of vaccine. What that means is they actually were already exposed to the virus, usually before they even received the vaccine. Next slide, please. So if I have had the vaccine, can I still acquire COVID-19?
Well, as Dr. Silvers presented, there was still a small number of otherwise healthy people that still got COVID. And so no vaccine is perfect, right? Even though we have 95% efficacy, there's still that 5%. And so we're still getting experience with these vaccines as well as time goes on and people get vaccinated. So we don't have enough data, especially on patients with chronic kidney disease at this time, to really say whether or not the vaccine works exactly the same in this population. So your risk of getting COVID might even be higher. So that's why it's just really important to get vaccinated. Next slide, please. Can I be vaccinated if I have severe reactions to other things?
Yeah, so the CDC has been pretty specific because this is a question that's been raised from the very beginning when the vaccines start to show some allergic reactions, and all the vaccines will have some allergic reactions. And so they specifically came out and said, these groups of people can be. I presented the slide that showed the groups that cannot, but these are the more common ones. History of food allergies, shellfish, peanuts, strawberries, any food allergy. History of cat allergies, insects, bee stings, venoms, environment, latex, anything unrelated to the vaccine or other injectable therapies are fine, and not fine that you have them, if you're okay to get the vaccine. any history of allergy to oral medications, non-serious allergy to vaccines, a family history, or a history of anaphylaxis not related to them. There's kind of an overlap in this, but these are all it is still acceptable to receive the vaccine if you have this history. What's important is that people who receive the vaccine with any sort of severe allergy history get observed for 30 minutes after they've been vaccinated. People without any allergy history are being observed for 15 minutes. If you have an allergy history, it should be 30 minutes. Next slide. So who should not receive an mRNA vaccine? And again, that's messenger RNA for the Pfizer and the Moderna.
Yep. And what CDC has given us guidance on is that severe allergic reaction, like anaphylaxis, after a previous dose of an mRNA vaccine, COVID-19 vaccine, or any of its components. Now, I know it can be really difficult, unless you've already had a dose, to know whether or not that you could be allergic to the mRNA vaccine or the components within it. As Dr. Silvers mentioned, he did talk about polyethylene glycol and polysorbate. So immediate allergic reactions of any severity, though, to a previous dose of an mRNA vaccine or any of those components, including a polyethylene glycol, you should not get a subsequent dose. So if you do know, however, if you have an allergy to polyethylene glycol or any polysorbates, you should not even get a first dose of the vaccine at this time. Now, I know it can be challenging, but like Dr. Silvers mentioned, polyethylene glycol is the particular excipient that is believed to be causing some of the allergic reactions you might be seeing in the media right now, and not the mRNA itself, but it is commonly in food, medications, especially some of the common medications that you might be taking, like acetaminophen. Some brands of acetaminophen have it in there. So it is very, very common. So I don't want you to think that it's just something that's in these particular vaccines, that it's in cosmetics too as well. So next slide. So this is a really common question and something that the CDC has guidance on, but there is a lot of question around what about the vaccine and pregnancy or breastfeeding and fertility? So should these individuals still get the vaccine?
Yes. So the CDC and the American College of Obstetrics and Gynecology and the Society of Maternal Fetal Medicine are three major organizations that review this, and they all support use of the vaccine in all these populations. They can't give you data that says it's safe yet, but when you look at how the vaccine is designed, the fact that it doesn't get into the nucleus, the fact that it's easily broken down in the tissues where it is, and the fact that also some people who got pregnant during the vaccine studies have done fine. There's no reason that they can be found for not suggesting that pregnant women receive the vaccine. In terms of breastfeeding, vaccines when a woman is breastfeeding are very advantageous just in general, because the antibodies that you make, the protection that you get from the vaccine, actually get into the bloodstream and then get into the breast milk and provide protection for breastfeeding babies. So that's one of the reasons that breastfeeding is considered such an important modality for taking care of newborns. So it's logical that the vaccine should be very helpful for breastfeeding. And then the question is, what about fertility? Again, there isn't data on that one. This particular vaccine, because of the type of virus it is, it actually should not affect fertility. The virus that gets into that causes COVID does not get into the ovaries or the uterus or cause disease that way when people don't have protection, and there's no particular reason to think the antibody from the vaccine would cause a problem. Next slide, please. If I had COVID, how long do I wait to get vaccinated?
And this is a great question, because some of it depends on, too, the answer here, and whether or not you had COVID with symptoms or if you had a positive test and didn't have symptoms. So you had symptoms, you should wait to get vaccinated until after the illness has resolved and you are no longer in isolation. So that would be a minimum of about 10 days from the start of those symptoms. And you want to make sure that you don't have any fever, and that's without taking medication. So if you have a fever that and you've been able to squash that fever with something like acetaminophen or ibuprofen, you really want to wait until you don't have that fever while not taking medications to reduce it for at least the last 24 hours. And of course, that those symptoms have been improved. Now, if you've never had symptoms but you had a positive test, it's good practice to wait a minimum of 10 days from when you had that first positive test and when it was collected, not when it was when you had a result, but when it was collected. So if you received a result 3 days later, go back to 10 days from when you actually had the test done. So I think there's more on the next slide for this question.
Yeah, but before we go there, can you go back 1 second? So not promoting brands or anything, for those who may not know, acetaminophen is more commonly called Tylenol as the original brand, and ibuprofen may be referred to as Advil, but those are generic names that Dr. Salazar gave you, and multiple products have those ingredients.
Thank you very much for that clarification.
Yeah.
Thank you.
Next slide.
Yep, next slide. So, okay. So, other people, how long should they wait? So, if you're an immunosuppressed patient, for example, if you've had a kidney transplant, you should wait up to 20 days, but really need to discuss with your local expert or, your primary physician. The challenge here is that, immunosuppression, when you're pushing down the immune system, that can diminish the immune response to these vaccines. So that's how the vaccines work, like Dr. Silvers explained. They cause an immune response. So you want to make sure there's an adequate period of time where if you're immunosuppressed, that you wait until you get the vaccine. And also, there are some treatments out there, monoclonal antibody or antibody treatments for COVID-19. They're injections or infusions into your veins. And if you've gotten those, the CDC recommends that you wait at least 90 days after getting that treatment or that infusion before you get the COVID-19 vaccine again, because you don't want that treatment, which is treating COVID, to mess with the response of that particular vaccine. Next slide. I think that might be the end of the slides. Oh, no, keep going. Yep.
Yeah. So what do I want you to take home? So let's look at the next slide. So remember, we are in the next phase of a historical pandemic that the world hasn't seen since 1918. Patients with kidney disease are definitely at increased risk to have severe COVID and to be hospitalized, possibly end up on a breathing machine or even die. And that is a major concern. And this is really our opportunity to put all of our work into action here by getting vaccinated and protecting yourselves, your loved ones, everyone that you know. Next slide. Remember, the mRNA vaccines have been proven effective. 95% is amazing. There's no living virus in the vaccines. Pregnancy, breastfeeding, fertility should be unaffected. Short-term symptomatic reactions to the vaccine are very common. Anticipate them, especially after the second dose. But boy, it is clearly outweighed by the benefit of vaccine. And I've talked to so many people who have received their second dose, as well as myself, and those side effects, those reactions are nothing compared to the comfort that you can feel after you've gotten the second dose. That like, okay, I've made a big step towards making sure that nothing bad happens to me. Next slide. Okay, we are ready.
Well, thank you, Dr. Silvers and Salazar. This has been extremely informative. We really appreciate your expertise and the time that you've given during this webinar. And now we want to hear your questions. So if you have not done so already, please submit any questions that you might have for our panelists using either the chat feature or the Q&A through WebEx. So we'll give you some time to go ahead and submit if you've thought of any during the presentation. We do have a few that did come in, so we can share those with you now. We have one. What happens if a patient does not take the second dose of the vaccine at the scheduled time? So if they miss 3 weeks or 4 weeks.
Dr. Salazar is going to answer that one.
Okay, sure. So that's a great question. And what's important to note is although the Pfizer vaccine has that 21-day second dose and that the Moderna vaccine has a 28-day second dose, the important aspect here is to not get it too early, but even if you're late, to still get it. In the studies, in fact, there were some recipients that got their second doses somewhere out to like 40 to 41 days after the first dose. Now, the CDC guidance out there for both vaccines, because it's important to not get it too early. Late is much better than too early. So the CDC's guidance out there is not earlier than 4 days before the target date. So for the Pfizer vaccine, that's, as early as day 17 because it's at day 21 is the target date. And for the Moderna vaccine would be at day 24 because their target date is day 28. So no earlier than day 17 for Pfizer, day 24 for the Moderna vaccine. But if the target day is missed, get it as soon as possible. And if it, even if you're a week or 2 or 3 weeks late, even still go and get that second dose so that you can have the adequate protection that is so much greater by getting the second dose than just the first dose.
So the CDC also says try and schedule it as close to the due date as possible. So Dr. Salazar is very specific about how far in advance it's allowed, but optimally, you need to really go out of your way to not have it early, but to have it at the scheduled time, and better a little late and than early. Next question.
Thank you very much for that. Should those of us that are long-term recipients have any special concerns? And by long-term recipients,
a transplant, right?
Transplant, yes.
Right. So the concern that I have is how effective is the vaccine going to be in people like who had transplants, and whether it's short-term or medium or long-term. The answer is we don't know. We're hoping that it is very effective. Typically, other vaccines are less effective in transplant patients than they are in patients who don't have any transplant-resistant disease. So I would anticipate it's going to be a little less effective. I just don't know how much. I am hopeful that it will still have good efficacy, and we will learn more. There's studies that are ongoing, so we'll know more. It should not deter you from getting the vaccine. It's very safe, and you don't have to worry about more side effects. Actually, if anything, you might actually have less reaction than people who are not transplant patients and may not notice as much, but definitely go for it.
Great, thank you. Also related to kidney transplants, transplant recipients, for kidney transplant patients, if you've received both vaccines and are now immune, how long will this immunity last?
Well, I'll start to answer this one. Dr. Silvers, if you have more after, please do. Unfortunately, at this time, we don't really know. Even even if you're not a kidney transplant patient, we don't know how long immunity lasts yet. These studies for the emergency use authorization the data submitted was only 2 months after the second dose. So we saw this efficacy. So we're constantly monitoring. Right now that we're giving it to people, we're going to have longer and longer data to know how long it's effective for. And hopefully, down the road, especially for, transplant patients, perhaps we'll have that information to know how long that immunity will last in everybody that's getting it.
Yeah, and I think that really answers the question appropriately. Understand, the pandemic just started 1 year ago. So obviously we don't have any vaccine data for more than, I've seen 3 months and some 4-month data, and that's looking very good, but that's all we have.
And this question is related to your answers that you just provided, and I just want to make sure that you're answering this question as well. Has data yet indicated how often individuals will have to take the vaccine annually, et cetera?
No.
I think you just answered that.
I did answer that. Anticipate people will need to get repeat doses, but we really don't know what the frequency will be. So it's not like a flu virus in terms of it doesn't have a season. So we'll have to, it's probably something that's going to have to be given based on when your last dose was rather than the time of year. And we won't know more about this probably for at least midsummer before we'll know much.
Okay, thank you. And we have one from a dialysis patient. I'm a dialysis patient and I'm not able to take the flu vaccine as it makes me very ill. I have been instructed to not get the COVID-19 vaccine. Is this the best course of action?
I can answer that if you want. So there's no relationship between the flu vaccine and the COVID vaccine. They're different diseases, and the vaccines are made different ways, and they have different components in them. And I know a number of people who could not tolerate the flu vaccine and have done fine with the COVID vaccine. And you do not see any guidance from the CDC or the Advisory Committee Immunization Practices or any major organization suggesting that you should not get the COVID vaccine based on a previous flu reaction. So the answer is get the COVID vaccine regardless.
Thank you for that. Does everyone in my household need to be vaccinated at the same time for the vaccine to work effectively?
Well, it might be easier, if you can get scheduled appointments around the same time, but no, they don't necessarily have to be vaccinated at the exact same time for it to work. Dr. Silvers, what do you think?
Yeah, so it's not feasible for everybody to be vaccinated at the same time because we have a supply and demand mismatch right now. So if you had a transplant or you're on dialysis or you have chronic kidney disease and you're almost on dialysis, you need to get the vaccine and not wait for the rest of your family to be able to receive the vaccine. You need to get protected. So I don't foresee that being something that people are going to be able to offer anytime in the near future. Once we get, maybe the latter part of this year, maybe at that point we'll be able to say, well, if your whole family wants it and no one's been vaccinated, go for it. But we do prioritize by underlying diseases and age and other risk factors for severe disease. They have to get it first. And, of course, where you work.
Thank you. Should I consider where I receive the vaccine? In my state, they are starting to offer grocery store. It looks like they're starting to offer receiving the vaccine at grocery store pharmacies.
In my opinion, as long as they have the precautionary measures in place to treat you should you have an allergic reaction, to me, there's no difference in where you get the vaccine. At those grocery store pharmacies, pharmacists are licensed and certified to administer those vaccines, and as long as they have the right precautionary measures that the CDC has recommended, my opinion is that it doesn't matter where you get your vaccine.
The other piece to that is not only the pharmacists licensed to administer the vaccine, they are also experts at maintaining the temperature control and the environment so that the vaccine doesn't go bad. So if you're going to be getting it by a pharmacist, they're licensed to make sure that the medicine, in this case the vaccine, is still safe to give. It's not expired. Yes, it should be fine in the grocery store or the CVS pharmacy or whichever pharmacy you go to.
Great. Thank you very much for that. And I'm going to ask my colleague Jerome if we have any other questions either in the chat or the Q&A queue.
Hey, Kim. Yeah, we do. One of the questions that came across in the chat is, can a person get a false positive test result after receiving a vaccine? Does the vaccine cause a positive test result?
And so that's actually a very good question. So the answer is the vaccine does not get anything into your bloodstream. It's not. It's actually the vaccine goes into your arm, and that vaccine stays there. The test is obtained from either the nose or the mouth, depending on what test you're having. That test in the nose and the mouth will not be false positive from the vaccine. Now, ultimately, a blood test after the vaccine works will be positive whether you've had disease or the vaccine, but that's actually what you want from the vaccine. So again, the test to see whether you're sick now, you will not be altered by whether you got the vaccine or not. Ultimately, the blood test will not be able to tell you whether you got the vaccine or the real disease. But again, that's the goal of the vaccine.
All right. So just so that everyone knows, we still have time for more questions for Drs. Silvers and Dr. Salazar. So if you have any questions about the COVID-19 vaccine, send us your questions through the WebEx chat or the Q&A section on WebEx. I do see that we had another question, and it is, will the vaccine protect against the new COVID-19 variant now confirmed in the U.S.?
So the answer is, the new one confirmed. Well, okay, so we have multiple variants right now. The one that came from the United Kingdom, the data is there that it looks in the lab, it protects. They take people who've received the vaccine, they draw their blood, and then they see if the antibodies from the person who got the vaccine can kill the virus in the lab, and the answer is yes. There's another new variant that's just being described now that we don't have data on yet, but it's anticipated that the vaccine will continue to work.
All right. We have a question from, I believe, a transplant recipient. And the question is, since we know that transplanted patients are such a higher risk, why are we not able to move up in the vaccine line?
That's a wonderful question. It's been I'm stumbling for words here because I'm on the vaccine advisory panel at the California State Public Health Department as one of the advisors. It is a very, very difficult task because it's such a mismatch between the amount of vaccine and the number of people that are candidates. And so the healthcare workers were first because if someone gets sick, you need someone. We need to have a group of people able to take care of you. So that's why healthcare workers are first. And then second, we've taken, it depends on what state you're in and what the guidance is. The CDC guidance just came out and said anybody who's 18 to 64 with underlying health problems, specific ones, and transplant patients are there in that group, should be in the same group as people now 65 and older. Now, that is wonderful. It's just going to be hard to find enough vaccine for everybody right now. So, I mean, the guidance is there, and so you are just right below the healthcare workers, and so the first group after the healthcare workers, but it's still going to be a challenge to find enough vaccine for all the people who qualify, and so it's getting there. It's going to take a little while, and definitely stick with it. And I wish everybody could get it today.
Okay. I believe this one just came in from another transplant recipient. This person is on the transplant wait list. If I get the first vaccine and get called for a transplant, should I delay until I get the second shot?
If it was, so I don't have any, can't base on any science, but I can tell you that if it was me and I was waiting for a transplant and I got a chance for my transplant, I'd go for my transplant. I wouldn't delay to get my second shot. No, I wouldn't do that.
Okay. Another question for in-center patients. Is it best to receive the shot before, during, or after treatment? Can it be washed out during treatment?
So, well, first of all, it's in the muscle. It's not in the bloodstream, so it's not going to get dialyzed out, the vaccine. And then antibodies don't get dialyzed out, and they take 7 days to form and to even start forming. So the answer is it wouldn't make any difference.
All right. Thank you very much for that. And it looks like we have both Jerome and I have been looking at the questions that have been coming in. We've got one last one that just came in, and then we will go ahead and conclude. So this will be the last question. Do vitamin D levels affect the vaccine?
Yeah, go on. If you want to answer that.
Yeah, I just don't think we're going to know that information. That's just information that hasn't been studied. Dr. Silvers, I don't know if you have anything to add to that.
Yeah, I would not anticipate that the vitamin D levels would affect so the vaccine. I presume you're talking about the response to the vaccine, because it's not going to affect how you feel after you get the dose, and it should not affect the response to the vaccine because there are different parts of the immune system that they're involved with. So I wouldn't expect it to matter.
Thank you again for your time with answering these questions, and thank you for everyone on the call. These have been excellent questions and have really helped facilitate this discussion. So if we could have the next slide. So as we have been discussing COVID-19 during this call, we also wanted to take a little bit of time to remind you that the NCC website has many resources for patient and family members. So the resources provide information about what to expect as a newly diagnosed patient, understand the grievance process, choosing transplantation, choosing home dialysis. So please visit www.esrdncc.org/patient to view patient and family member resources. Next slide. And as you are searching the web for information, it's also important to make sure that you're going to credible resources. The NCC offers a few resources on finding credible information on the internet. So please visit kidneycovidinfocenter.com and then click on For Patients. And on our next slide, our final resource, we want to remind everyone about the kidneyhub.org. It is a mobile-friendly web app developed by the NCC with lots of input from our patient subject matter experts. It has information on home dialysis, the kidney transplant center, kidney transplant process rather, information prevention, mental health, and more. And recently, a diet and nutrition section was recently added. So please take a look at it today and let us know what you think or if you have ideas for other content. And you can do that by emailing us at nccinfo@hsag.com. And on the next slide, we invite you to mark your calendars for the next patient COVID-19 webinar event. And the next event is Tuesday, February the 2nd at 4 p.m. Eastern Time. And we also have two upcoming provider-focused events, one which will occur tomorrow, January the 20th at 3 p.m. Eastern, and then our regularly scheduled program will be on January 27th at 3 p.m. Eastern. And again, you can find all of our schedules at kidneycovidinfocenter.com for more information and to register. We want to thank you again for joining us today and for being with us this afternoon. For additional COVID-19 resources, feel free to visit the CASER website at casercoalition.com. Thank you, everyone. Have a good evening, and please check back our website tomorrow, and you can find the slides. I know that someone had asked about the slides, so they will be available tomorrow. Take care.
Thank you. Stay safe. Get vaccinated.